हेलो स्टूडेंट्स, वेलकम टू माय यूट्यूब चैनल। स्टूडेंट्स, हमारा आज का टॉपिक है रेडिएशन हजार्ड्स एंड देयर प्रिवेंशंस। रेडिएशन हजार्ड्स refers to the harmful effect of exposure to ionizing radiations which can damage living tissues and DNA. These are characterized as टाइप्स ऑफ रेडिएशंस। सबसे पहले अल्फा रेडिएशन, हैवी एंड स्लो, हार्मफुल इफ इनहेल्ड और इंजेस्टेड। सेकंड, बीटा, लाइटर देन अल्फा, कैन पेनिट्रेट स्किन स्लाइटली। थर्ड, गामा एंड एक्स-रे, हाईली penetrated and pose serious external exposure risk. Neutrons, highly penetrating, usually from nuclear. Second, sources of radiation exposure. There are two types of radiation exposures: natural sources and artificial sources. First, natural sources: cosmic rays, random gas, radioactivity elements in Earth. Second, artificial sources: medical imaging, X-ray, CT scan, radiotherapy, nuclear medicine, industrial radiography, and nuclear power plants. Third, health effect of radiation exposure: acute, short-term, high dose, radiation sickness, skin burns, nausea and vomiting, organ failure or death in extreme cases. Second, chronic long-term, low doses. Cancer, example leukemia, thyroid cancer, genetic mutations, cataracts, decrease fertility. Now we can talk about radiation protection and prevention. First, basic principle: ALARA, full form of ALARA is as low as reasonably achievable, minimize exposure time, maximum distance from the source, use effective shielding, that is, lid aprons and barriers. Second, protective measures: time, limit duration of exposure, distance, increase distance from the radiation source. Third, shielding, use appropriate material, example, lead from gamma rays. Third, personal protective equipment, that is called PPE. First, apron and gloves, lid, thyroid shields, lidded glasses. Fourth, monitoring and safety practices. First, dosimeter, film bandages, TLDS for personal. Warning sign and label in radiation areas. Regular equipments, calibration and maintenance. Controlled access to high radiation zones. Fifth, regulation and guidelines. Follow national international standards. Examples: AERB and ICRP. Proper licensing and training for radiation workers. Emergency preparedness for radiation accidents.